In the last 6 months, I was really struggling and looking for options, which there aren't that many. I have been diagnosed with systemic sclerosis or scleroderma, in other words, when I was about 10 years old, I believe. One thing I did know that there are no side effects, so it can only help. So therefore, there is no risk. The risks are so small. The staff was so friendly, so kind and so caring. I'm not a biggest fan of needles, and they made me feel really comfortable, as comfortable as I could. I'm saying that there is nothing to lose and everything to gain. I was not worried. I was actually quite excited to see the results. So hopefully, fingers crossed.
Good afternoon, ma'am. Pleasure to have you with us. Would you be so kind to introduce yourself and tell us what brought you to Swiss Medica?
Hi, so my name is Carolina. I'm from UK, and I have been diagnosed with systemic sclerosis or scleroderma, in other words, when I was about 10 years old, I believe. I originally, they thought it possibly would be a juvenile form because I was a child. I did go into remission for many years, only for the condition to come back later on in life when I was 20, then we went into remission again, when it came back when I was around 30s, and in the last 6 months I was really struggling and looking for options, which there aren't that many.
Understood. So since the first onset of symptoms, can you share with us how it affected your daily life? Even back then in the early childhood, and how it affects you today?
The condition comes with the pain, stiffness, deformity, because obviously this is a condition that affects the connective tissue, and therefore can affect mobility at some point as well. So that's the biggest worry. So nobody wants to get there. So yes, it's a collagen. Basically, it's a collagen problem. The collagen buildup in tissue. So and it does cause pain, and skin changes as well, and it can affect joints depending on the person. For me, it's mainly skin and joints.
Joints. And back home or anywhere else, did you try some other therapies? What were you advised by your doctor to do?
It's always the same protocol, especially in UK. I don't know anywhere else. Well, I'm from Lithuania. Originally, I was diagnosed back in Lithuania, and I was quite little, so I could not tell you the medication I was prescribed, but I think it was pretty much the same protocol as what I have been given in the UK, and it's standard like for any other autoimmune condition, which it is. Steroids, immunosuppressants like methotrexate or antimalarials. So and it's not a solution. It's only a mask to suppress the symptoms, to suppress the immune system, and with severe side effects, which I didn't want.
Understood. And I suppose before coming here for stem cell treatment, you did some kind of research of your own.
Yes.
So could you share with us what did you read or what have you seen about stem cells that inspired you to come here to Serbia for relatively new treatment?
Well, I think like for any patient with conditions like this, Google is your friend and also an enemy at the same time. There is a lot of information out there, but you try to grab onto anything that would suggest if there is a possibility of a cure or a better treatment than immunosuppressants and therefore that's what I was looking for. And obviously some research came up that stem cell therapy potentially could be really beneficial for autoimmune conditions, and that's where I started.
Did you maybe went to your general practitioner in UK to ask him or her about opinion? And
yes,
did they voice
it was
any kind of
actually really
thing?
recently. I've already booked to come to Serbia with Swiss Medica, and I had the usual a consultation with my rheumatologist and dermatologist, and I said, what about stem cells? And they just the answer is that we don't know much about it. This is not something that we offer. There isn't it's not a viable treatment in UK at the moment.
And did you have any kind of worries or apprehensions trying stem cell treatment? Did you fear anything or
no, not really? No, because obviously one thing I did know that there are no side effects, so it can only help. So therefore, there is no risk. The risks are so small that they aren't really risks in comparison to any other potential treatment. So I was not worried. I was actually quite excited to see the results. So hopefully, fingers crossed.
And if I may ask, I mean, Serbia is still part of Europe, but might be an unfamiliar country for you. Traveling here, did you have any kind of worries, like what's gonna be? Is it gonna be safe? I don't know if have you managed to visit the Belgrade yet.
We have visited Belgrade, which is the team here are facilitated, and we're going back again today for another look and to visit Tesla Museum. But the first thing I did to Google things to do in Belgrade, and I thought if I had time, we'll go and visit. I travel a lot, so for me it's never a thing.
And if I may ask, so far you went through all procedures, you did your discharge, so was everything safe? Did you feel that you were in good hands? Was everything explained to you comprehensively? Could you just share with us your general experience with Swiss Medica from initial contact to
everything was great. Generally, no worries. The staff all speak English, which is obviously very nice and easy. Everything is explained, sometimes more than once. But yeah, I never had any worries. As I said, the staff was so friendly, so kind, and so caring. I'm not a biggest fan of needles, and they made me feel really comfortable, as comfortable as I could.
I would like to ask. There are other clinics that provide this kind of service, so it's always intriguing for us. Why did you choose Swiss Medica? I don't know if have you spoke with other clinics, but what differentiated us from the rest?
And honestly,
could you pinpoint some
I only found one other clinic from when I've done my research, and they were in Israel, and I wouldn't go to Israel at the moment. That made my decision very, very easy. Serbia is still in Europe, and also you have another clinic, I think, in Slovenia, and I've been to Slovenia before, and it's a beautiful country. And I thought, Serbia, Slovenia, that doesn't matter. I just didn't want to go to Israel.
Understandable. And the last questions we always like to ask. For people suffering from same condition as you are, would you have any kind of advice or a general insight that you would like to share?
I mean, it's early days, obviously early days, but I'm saying that there is nothing to lose and everything to gain.